So this question comes in from Paula, and her question is, what is the most effective approach for successfully treating OCD and trauma? This question comes sometimes because trauma will hide. I often say that there's many people out there that are living with trauma from the past, and depending on the severity of it, it can really impact both anxiety, OCD, and trauma. So when treating OCD and trauma together, along with the anxiety that it creates, we need to look at a few different things. With both of these conditions, our symptoms can be really quite similar in certain ways, because both OCD, trauma, and anxiety will change our brain, and both can lead to an elevated level of anxiety and often to depression as well. The nice thing is both can be treated with cognitive behavior therapy and ERP. Now, I often will write notes just to make sure that I cover everything. So I'm just going to mention a few things. With trauma, just like OCD, we need to be able to face our fears over and over in order to become desensitized to them. In the situation of trauma we can hold on to for a very long time and not even realize it sometimes till decades later or years later that it's the trauma that is holding us back alongside the OCD. So again, being able to treat both is very comforting to know. And in both situations, we are dealing with the fear that we have learned to cope with, but we are dealing with it by starting to confront it now and being able to do that in a gradual way so that we are able to have wins and victories over the thoughts of the trauma. So in the situation of trauma, if we face the fears, we realize and can recognize that it's not as scary of a thing now as it was back when it originally occurred. And I don't want to say this to belittle or minimize it, because it can be very devastating, but we can learn to live with and deal through the trauma over a period of time. Interesting enough, when I did some research on trauma, one research in particular, when it came to the United States, 70% of the United States have experienced at least one form of trauma. And now, not everyone having experienced trauma will go on to have difficulty with it. Many people can overcome it, but there is a small percentage that it will lead to PTSD, post-traumatic stress disorder. Now, I know this is not maybe as relevant for some people, but I wanted to share that there's two forms of trauma-related disorders, one being acute stress disorder. And in this type of a trauma-related disorder, the concern is resolved within a period of 1 month. When it goes beyond 1 month, that's when it becomes post-traumatic stress disorder. So it's really key and essential to have early detection, early diagnosis, so that we can start working through the OCD and the trauma and the experience that someone has had. Now, even though the memories of the trauma will still be with you for long periods of time, it will have less power over you and your emotions, just like it does with OCD. So it's nice to know that both can be treated simultaneously. Now, sometimes it may involve two therapists that you need to work with, or two coaches, one in the expertise lane of OCD and one in the expertise lane of trauma-related disorders. And sometimes if you're blessed and lucky enough, you may have somebody that can do both, because both of those things are part of their expertise. Now, very specific learning and implementation for each. So we've got to target exactly what's going on in the OCD realm as well as the trauma. Okay, so now what we tend to do often leading up to treatment, prior to treatment, is we tend to avoid. So avoidance in itself is a coping strategy when faced with certain sensations, feelings, images, or thoughts, or memories brought on by the obsession or past trauma. So I hope that's helpful in answering that question.